Welcome back. Well, March is Colorectal Cancer Awareness Month, and if you didn't already know, colorectal cancer is the second leading cause of cancer death in the United States, and Louisiana has the country's fourth highest death rate from colorectal cancer. Joining us now with more is Medical Director for the New Orleans region of Blue Cross and Blue Shield of Louisiana, Dr. Jeremy Wigginton. Welcome back.
Thanks so much. I appreciate you having me here.
Of course, we're glad to have you. So just starting out, tell us why it's important to be aware of colorectal cancer.
Sure. Well, as you said, March is Colorectal Cancer Awareness Month, and I think this is a great opportunity to tell everyone in Louisiana about the importance of getting screened for colorectal cancer. At Blue Cross, we're really focused on improving the health and lives of all Louisianians. And as you said, colorectal cancer is the second leading cause of cancer death among men and women in the United States. And so really knowing about why you should be screened, how you can get screened for colorectal cancer is extremely important. There are some general things you can do to reduce your risk for all types of cancer, such as exercise, maintaining a healthy weight, not using tobacco products. But colorectal cancer is very treatable if you catch it early enough. And so getting screened is absolutely the best way to catch it very, very early so that you can help to reduce your risk for problems later down the road. And so it's extremely important, yes. So
well, why are the statistics so high? Is it because that people are just kind of afraid for the screening process, or?
They absolutely may be. And so the best test for screening for colon cancer is called a colonoscopy. And it's actually when a provider uses a small camera to look inside the entire large intestine. And that's actually what most people call the colon. And so by using that camera, they can actually search for signs of precancer and actually remove them at the same time. Those are often called polyps.
Right.
So that is the best test to screen for colon cancer. There are now much easier ways to screen for colon cancer. One of the tests is about the size of a deck of cards. You take it home, you collect some samples yourself, and that can be tested for signs of possible cancer. The downsides to those things are that they are not as good as the colonoscopy, and there are certain factors that you may have to take into account to see if that's the right test for you.
Sure.
And so we really encourage people to go to their primary care doctor to talk about their individual risks for colon cancer, what kind of medical conditions you may have had or symptoms you may have had, to see what test is absolutely the best for you. And another important thing to talk about is really who should be screened. And so one agency in the United States called the U.S. Preventative Service Task Force currently says that the general population in America should be starting screening at age 50. However, some other agencies have recommended possible earlier screening ages, and also if you have a strong family history of certain cancers, including colon cancer, you may need to start earlier, or if you've had certain medical conditions, you may have to start earlier as well.
I see. So this is truly a case-by-case basis. Can you kind of elaborate on that? I mean, everybody's different with this,
Of course,
it sounds like.
Absolutely. Like I said, if you have certain medical conditions, or if you have certain family histories of colon cancer, then really
these are red flags.
Yeah, exactly, red flags. Or if you have symptoms such as bleeding, again, you may need a certain type of test to see if it's possibly could be from a precancerous lesion or a colon cancer, or like a polyp like I was talking about. So really everyone should start by talking to their physician as early as possible. Don't think you're too young to start talking to your doctor about colorectal cancer screening. Again, it may depend on your family history and medical history that you may need to start earlier than 50. So that's really important to start talking to your regular doctor about when it is right for you.
Sure. And when we talk about coverage, is the colonoscopy covered on health plans?
Yes, most health plans, such as Blue Cross, their commercial plan, Medicare plans, little to no out-of-pocket cost for the screening tests. And again, talking to your doctor about which one of those types of tests is right for you, because some of them are easier to do, but again, it might not be the best for you. And again, if you're going to the to do, say, the colonoscopy, which is a minor procedure, that has gotten so much easier over the last 10 years. So
don't be afraid. I mean, this could save your life, as you said.
Screening saves lives, and the only way you're going to know if you have a precancerous lesion is to get screened, and that way you can get it taken care of as early as possible. And so, and if you're going to go with, say, the colonoscopy, which is a type of procedure, Blue Cross has other tools there to help you figure out how much it's going to cost, or get it the lowest cost possible. You can contact Blue Cross about your individual plan and see what the out-of-pocket cost may be. They have a program called the Smart Shopper program, which you can then utilize. That is on the Blue Cross website. I think we'll have that posted for viewers so they can see the website. That will also help you to do some shopping to see how much it's going to cost for you, if anything.
Perfect. And thank you, Doctor. That was a great transition. So here are the websites you can see on your screen. You can visit bcbsla.com/smartshopper or bcbla.com/stronger. There's also a 1-800 number on your screen too, 1-800-821-2749 for more information.